Yes, hello. Good to
Sure.
see you.
Hi. Sorry for being a little late. I had some issues connecting, but I'm here. I'm happy to be here.
We saw you come on and then disappear, but we are glad you are back.
Yeah,
Uh,
me too. I'm
yes,
so glad to be
Amy has not had a break yet since this morning, all the
here.
questioning and then all the live sessions. So thank you so much. I think I'm going to get started if that's okay. Bethany is on, so I will just check whether there is any logistical things that we should share before we get into the session.
Oh, you
Okay,
can go ahead and
Bethany,
begin.
give us the green light to move forward. So welcome everyone. This is our session about selecting, combining, adapting, and using frameworks for pragmatic research. My name is Borsika Rabin, and I am affiliated with the Accords D&I program. I also have an appointment at UCSD, and I have been working with Ross, and Amy as well, actually, through the VA work for the past several years. So I'm excited to have them on a panel and ask difficult questions from them. I did give them a few heads up questions, but there will be tricky ones. Our goal today is to follow up on some of the prior sessions of the conference so far and expand on them. And a focus really will be to get into the details of what are some challenges with selecting, combining, adapting, and using frameworks where you are in a pragmatic research context. And so I will go through a few introductory slides here, and then I will open this up for a Q&A, and we would love to have your questions. So please send those in through the chat box. And also, while we are having the discussions, I will be monitoring that chat box. So we will have a very brief welcome as we have done it and introductions. I will show you just very briefly who our panelists are. I will give you a very short overview of the session in terms of general concepts around selecting, combining, adapting, and using frameworks. And specifically, I will introduce you to a web tool that you might find useful in your work doing these activities. And then we will have a discussion about these issues with our panelists, and we'll wrap up and have any closing remarks if you wish. You have information about all of our panelists, and I will not spend too much time, but I did want to call out specifically Dr. Kilbourne, who was our opening keynote as well. She is the Director of Quality Enhancement Research and Initiative at the VA and has multiple roles in advancing the field in pragmatic science. Dr. Brownson, who is a professor from Washington University in St. Louis and has also multiple roles in developing further resources and tools for dissemination and implementation research and pragmatic research. And Dr. Glasgow from the University of Colorado, a professor with us and the director of our dissemination and implementation science program, who is well known for his REAIM framework and its expansion, the PRISM, and also used to be the lead of implementation science and NCI. So they all bring very unique perspectives to this discussion. Just relating our discussion now to previous sessions, many of you had a chance, I hope, to listen to the keynote address by Dr. Amy Kilbourne, where she introduced us to some basic concepts and very wonderful examples around pragmatic health services research, and so also discussed some challenges and opportunities to address health disparities. Also, Dr. Amy Huibschman talked about planning for pragmatic research and specifically highlighted the role of PRECISE-2 and the REAIM framework as examples of using frameworks in the planning phase of pragmatic research. And then Amy had a wonderful discussion, live discussion that many of you joined and had questions. So we are going to continue from that point. I also hope that you spent some time visiting some of our tours of frameworks. As you can see, we were able to include 5 different frameworks, and we asked experts in those frameworks to talk about those, and you will be able to access retrospectively these sessions as well. But we included PRISM REAIM, the EPIS framework, RAP, Knowledge to Action, and the Small P policy framework. So we have a number of different variety. These are not all of the frameworks, as you will hear it from me, but these are wonderful examples of diverse frameworks that could help pragmatic research planning. So if we were to look at the variety of frameworks that are available. You will be in the 200s. Many of these frameworks were identified through systematic reviews. So the question often is, which one should you use? And so we will try to get into this question in this session and give you some guidance. We included in our workbook some general questions that you could use, and these appeared in previous presentations as well, that could help you just kind of frame your thinking around selecting frameworks, which could include thinking about your research question, the scope of your study, the purpose that the model will play in your pragmatic research, the key constructs and levels of analysis that you will be including in your work, the socioecological levels, thinking about whether one model will be useful enough or you need multiple frameworks. And we'll talk a little bit about the challenges of combining frameworks. I will ask the panel about that. And what ways the model need to be adapted potentially to your local context. And finally, it would be wonderful to choose frameworks or models that are have available measures and examples so you can easily transition into using them in your own work. And then finally, before we move into the discussion, I wanted to introduce you to a web tool that we have been working on for the past several years, trying to facilitate your work in this difficult process of making sense of a couple of hundred different frameworks. This web tool is available publicly, free. You don't have to log in, at least not if you don't want to rate or comment on the models, but just to use it, you can just freely go on the website that I provided there. And as you can see, we identified 6 separate sections of this website, and each section provides you with guidance on different steps in identifying frameworks, including planning and using a logic model, combining them, adapting them, using them, and measuring them. The first section I mentioned already, the planning section, gets into the details of how you can use logic models in identifying key constructs for your pragmatic work. And we have some tutorials and examples for this. The second section, which is perhaps the most complicated section, is about selecting or searching models, which allows you to access these. We have on this website only about 102 models of the 200, but you can access them in different ways, including looking at the full list or searching them. So you get some guidance on that. And then again, we will talk a little bit more about the combining, adapting, and using, which all have some guidance, and then measuring, trying to link you to specific measures. A couple of more pieces of information. We are in the process of updating this website. We conducted some extensive usability testing and have some great recommendation from diverse users. So in the coming 2 months, you can expect additional functionalities and some change in look as well. So we will look forward to sharing that with you, but for now, this is the tool that you can access and use. And just reminding you that this conference also developed a workbook and we made it available to you. So for these sessions that you see listed here, which was basically our opening sessions and the session currently, we have 6 guiding questions that might help you get through the challenges of choosing frameworks. And as you can see, very often we link directly to the web tool so that you can get more details. So just a reminder, and this is a quote that I don't have the person who initially generated it, but we know that it has been emerging perhaps in the UK and then carried through the country. So now we are, all of us are using it. We find often as we discuss with researchers that theories are like toothbrushes. Everyone has one and no one wants to use anyone else's. So perhaps the only take home that you will remember from this session is that perhaps try to use one of the 200 models first before you start to generate a new one, and look for examples of how these models have been adapted in case you feel that this is not a right fit for your research, because adaptation can make a lot of fit issues resolved. So, brief introduction. I would like to now open this up for discussion with our panel. And again, I'm excited to have these very knowledgeable experts from different areas. I am going to have to stop sharing my screen because I want to see the live chat. So I'm going to go back to the chat area and see whether we have questions. But while I am looking at those, and I already see some, I will have to make sense of them. I am going to ask a question from the panel members that I prepared, because I am always intrigued to hear from them about examples of situations where frameworks really benefited their work. So concrete examples of how pragmatic research became better, more impactful as a result of using frameworks. And I will actually start with Dr. Russ Glasgow to answer this question. And then I am thinking I'm going to ask everyone this question. So let's start with you, Russ, if you could.
Okay, thanks. Well, and to demonstrate one of my usual characteristics, I'm going to kind of address, but not directly address your issue, answer a slightly different one, because I gave a couple concrete examples in the earlier tape thing that I did. I don't want to take the time to go into detail, but in general, I think I'd say there are two things that I found really useful in our own work and why I think it's important to use a framework. The first one is to help us think about where to focus. Somewhat systematically. So to think about like what are some of the key factors, the likely determinants, and what are some of the key issues so that we don't miss something important. And the second one, somewhat conversely, but I think also equally important, is to help us maybe anticipate both the likely and maybe unintended consequences of doing a particular intervention paired with a specific implementation strategy or strategy bundle. And just a quick note on that, from our own REAIM framework, what we found is that often efforts that are done to like enhance one of the dimensions, to kind of go all in on that, typically effectiveness, can have adverse consequences on some of the other key goals, for example, reach, implementation, and maybe health equity.
This is great, Russ. Very, very good example of a previous question that we posed, what kind of adverse outcomes we can expect from using pragmatic research. So I really like that. Amy, would you mind to go next with this question about, I know that you provided an example about the use of Rabin, the re-engage program, but do you have any other more generic concepts about the usefulness of pragmatic research frameworks?
I think, yeah, definitely, I think so. One of the ones that I really was drawn to that really helped me think about how to design a pragmatic research program was in part, and it's an implementation framework in itself, is CFR, the Consolidated Framework for Implementation Research, because it basically is a great model for essentially telling you what possibly can go wrong with your study if you do not consider the different factors and dimensions of CFR. And if you miss something, you know, you may not have the sustainment going forward. I also liked it too because it did actually present how everything could be interrelated. And when I started out in implementation science, REP was perfectly fine. In many respects, it was a perfectly fine model to start with, but we ended up adding things to it based on CFR, and we ended up adding stuff and in part, and I'll just say this about frameworks. I think the reason why there's so many of them is I think it's fundamentally part of how we do implementation research, and is that we don't get funded unless we're innovative. And so there's always this pressure to have the new model or theory or framework. And I think in many respects that I'm hoping that study sections can maybe pivot from that and just sort of accept the frameworks that are there out in the field, and then look more for innovations around the study setting or the thing that you're trying to implement instead. But I'll get off my soapbox right now and let you talk.
No, I love that again, because we have started a slide in presentation of how you can be innovative with the old frameworks by adapting them or combining them or testing them in new settings. So I think that not the necessity of innovation is not in developing a new framework, but how you use them perhaps. And I'm so glad that you highlighted that, Amy. Thank you so much. Ross?
Yeah, so I guess I'd say two things. One sort of builds on both what Russ and Amy said, and to me, the biggest benefit and where it's helpful in a pragmatic study, a D&I study, whatever you call your research, is it gives you a systematic structure for your research. And that could be, you know, what you're trying to measure, what are the key constructs, even getting to how it lines up with your aims. Sometimes there's a part of early stage research where you're really, like, say there's contextual factors, you're trying to figure out what those contextual factors are, which are always often barriers and facilitators and other characteristics of the setting or the population. And I guess the other one that's a little different, I mean, I was thinking about this in relation to COVID, how COVID has kind of been the example to me of trying to do science on steroids, where it's happening so quickly. I mean, take masks, where, you know, once we aren't recommending masks, and then there's a lot more literature, and now masks are highly recommended, are an evidence-based practice. I think if we don't have a framework or a theory to follow, we sort of lose that structure, and we're always measuring different things, and we're always trying to look at a problem with a new framework, and there's no replication that can happen. And so I think in a way, you know, replication is often not thought of as innovation, but in a way, to me, replication, when done well, as you said, that brings in adaptation, it is innovative, and it really is part of what our field needs. So there's a couple random thoughts for you, Borsika.
These are very helpful. I just love the connection with COVID-19 and how frameworks can help with a very pragmatic and current issue. We had another question here that is kind of relating to previous things that you said, but I will read it. It's a longer chat question, so you might want to read it in your own chat as well, but I will read it out loud. So can you expand on the settings where each of the frameworks can be applied? There were some mentions of primary care clinics, public health organizations, VA health system. I wasn't clear on possible other settings where frameworks can be utilized. Can the settings be global, another country? Is there any examples of a global health work for pragmatic research? And clarification, by another country, I mean low-income, middle-income countries and settings. I'm wondering if there are any examples of interventions in long-term care settings. So lots of pieces to this. You are welcome to pick any of it. Amy, would you like to go first?
Sure. I mean, I can probably, what's interesting about the Replicate Effective Programs framework is that it was derived from the Centers for Disease Control's work on rapid expansion of HIV prevention interventions here in the US and internationally. And it derived its origins from anthropology and the lessons learned from anthropology around, at the time they called it technology transfer, which is essentially translating effective interventions in communities that are essentially in lower and middle income countries. Like, you know, think of Peace Corps, you know, essentially. And that's how a rep was really, in many respects, originated. That's why it's very front loaded around getting the fidelity to the thing that you're trying to implement correct, and articulating what those pieces are. And I think that's why they emphasize a lot around the use of community working groups and things like that. So there are probably similar frameworks out there and have been used in global health to do the same thing. I know the Gates Foundation has thought about some of these things as well in terms of frameworks, especially involving community input. But I would say, you know, I think in many respects, that a lot of these same, the notion of community input and just sort of essentially demystifying the intervention for people to use on a routine basis, I think are key things of almost any framework in global health. That's just my sense.
That's very helpful. Thank you. I was wanting to go to Ross next, Ross Brownson, because I know that you have been teaching evidence-based public health around the world and tried to introduce these frameworks or others to people coming from different kinds of countries. So what is your experience with the use of these frameworks outside of the US?
Yeah, it's a good question, Borsika. You know, I think, and so just for the group who don't know me, I work mostly in public health, mostly in state and local governmental public health. And of course, that structure looks different in different parts of the world. In some places, let's say a smaller country, the public health functions could be very much centralized in the Ministry of Health, for example. That in many ways is sort of like one of our state health departments. And so I think the structures for public health can be very different. In other countries, you tend to have people formally trained in, let's say, an MPH degree or some formal training in a public health discipline. The basic concepts are all pretty much the same, I would say. You know, so if we take any of the evidence-based public health frameworks we use, the one I used in this example was one we call the administrative evidence-based practices. But if you think about sort of an evidence-based intervention or an evidence-based practice or policy, which is often, you know, kind of the focus for D&I science, an administrative evidence-based practice is more about the organization, about what makes an organization evidence-based, not what they're trying to do, but the characteristics and the functioning. And I think that those concepts very much apply. I think when you get to sort of, so that's kind of small p policy within an organization. I think when you get to big P policy, if you think about a centralized government, China, for example, and the governmental structure there compared to the governmental structure in the UK, there are very big differences in how big P policy, governmental policy works. And I think that's where these frameworks in the policy settings really do have to change to adapt to a very different policy context. But I would say most of the frameworks you talked about, Borsika, the 200 plus, they would apply. They take some different work in kind of setting the context, looking for the differences. The one other thing I'll add is a lot of I don't know if we've ever looked at how many of those 200 are we would call a research framework versus a practice framework.
Yep.
But there's a large number that are practice oriented that were not designed for research. And for many parts of the world, that might be the most important question. They might not be trying to answer a research question. They might be trying to evaluate a practice. And so it's worth looking at, you know, a variety of different kinds of frameworks and frameworks coming from different disciplines as well.
Thank you so much. This is great for us to remember that policy frameworks, perhaps we have the fewest of those, but they're critically important. And as we think about COVID-19 or other issues, these higher level frameworks need to be brought in. So I think that we will have to highlight those more in our work. Russ, you have recently worked with Central and South American groups and applying REAIM and PRISM. So I was wondering whether, and it will be the last comment here because we are getting to the top of the end of the session. So if you could share some of your experience using these more broadly, or anything that you want to talk about, I guess.
Sure, we have. I will note that ours has been, as well as our colleagues, fairly widely used internationally. One of my colleagues just got back from presenting on our PRISM framework, which is a little more complex. It was interesting to me than just REAIM in South Africa with a number of African nations. So I think most of these have been used. To get one of our other topics we aren't going to have a chance to, in my experience, I think most of them need to be adapted though. And again, because as Ross said, the context is so different, particularly a lot of the healthcare funding, certainly the resources available and that sort of thing. Final thing I'll say on this is I know the WHO has a publication on implementation science that highlights a few of these that have been broadly used. And I'm guessing that Fogarty does too. Maybe we can send out some other key follow-up things on this.
Sounds great. You know, time goes by fast when you are having fun, and we are on the top of the session hour. I am going to thank you, our panelists, for their wonderful comments and contributions. Please do watch these sessions if you haven't had a chance about the individual models. And I also would like to call your attention while I introduce the next activity. Leah made a comment in the panel, and I don't know if it's visible to the participants, that she had some work in Puerto Rico using long-term care related frameworks. And so I would love to connect Leah with the person who asked the question about long-term care frameworks. So I will ask our organizers to save the chat and we will make that connection. And with that, I just want to let you know that we will have a few-minute break, and then on the top of the hour, 12 o'clock Mountain Time, the networking lunches will start, and you will be able to pick one or multiple of these. You can go to the website, to the agenda, and please also download the handouts that come with each discussion that you will be participating in. Ross, Amy, Russ, thank you so much. This was wonderful, and look forward to communicating in next sessions.
Thanks, Borsika. Thanks, everyone.
Thank you. Thanks,
Take
everyone.
care.
Good luck.
Thank you.